How many of you guys actually have talked to a doctor and they listen to your problem and they're like, I see you and I know what's going on and I can fix it? That's what happened for you with me. This was like, I don't know, 4 or 5 years ago. Without doing any other radiological studies, he examines me, he touches me. Touch is so important. This is like, how do we go above and beyond being a needle jockey and be a magician? A magician needs to touch. So he touched me, and do you want to explain the diagnosis?
Yeah, you had occipital neuralgia, but you've been treated for it.
Wait, hold on. They don't know what occipital neuralgia is. So
she has some nerves coming out between the first and second bones in her spine, and that those nerves travel up the back of the head, have a predictable pain pattern. When they're compressed and they're injured, it causes a lot of dysfunction in the upper cervical spine.
Essentially, you pushed me right here, and I went, ow!
Right back here. And then it radiated up
to my eyeball.
Yeah, then that's classic. That to me, if I find somebody, I push on their occipital nerve and it radiates their eye, 95% of that is going to be occipital neuralgia.
But that requires someone who to actually touch a patient, push a patient, know the nerve that goes from there to there, and for me to go out. And here's the thing, I'm a doctor. It's not like I don't know what occipital neuralgia is, but I've been stuck, needle focused on it's TMJ, it's my jaw, it's this, I got to see the dentist.
The reason that you had TMJ was that all of the hypertensity in your upper neck was pulling fascial planes, and it was changing the way your bite and your jaw worked. Right. And so people don't understand that if I have dysfunction in the upper cervical spine, it can change the way that your jaw functions and work. Though in the vast majority of our upper cervical cases that we see, people have TMD. And there's a lot of chiropractors in the world, especially upper cervical chiropractors, that understand this concept innately. They know that that upper cervical complex is going to relate through fascial change.
So in regular words, but what I want you guys to understand is when he's talking about the upper cervical complex, let's put it in simple terms, is that, is these vertebrae, the top vertebrae, like, there's your skull, and then the first couple of vertebrae is what we call C1, C2, and then it goes down C3 and it counts down. But those C1, C2 are very difficult to actually diagnose problems with and to treat. But when something's wrong with them, those two vertebrae, it is catastrophic for people. Yeah, it will cause people to have severe migraines. It will cause people to have severe TMJ. Dysautonomia, POTS. This is where we're going to tie it in, everybody. POTS, dysautonomia, long haul, TBI, traumatic brain injury. That upper cervical complex is really critical, and very few doctors understand how to diagnose problems with it, how just a little bit one angle off, one nerve slightly touch over there can cause literally feels like the end of your life.
Or too much instability. That's a lot of problems with people having the cranial cervical instability. It's instability up high. Creates brainstem issues, which leads to that dysautonomia.
Well, let's talk about that. What he's saying is that, when above the C1, C2 is what we call your brainstem. So your brain, think about it as this big old thing, and underneath it, there's a little stem there. And the brainstem is right above C1, C2. And the brainstem is where we call the cerebellum. The medical term for it is the cerebellum. But here's the thing is, the cerebellum, does anyone know that's the center of? Your balance center. Between your ears, your brainstem, and the C1, C2, that triangle right there is where the balance center lives. So what you're saying is, when these bones are unstable, that C1, C2, it can really impact the level right above that. It's your brainstem, which is your balance center.
I mean, you had dizziness, you had headaches, you had fatigue, you had brain fog. It wasn't just the pain and the dysfunction. You had a hard time reading and focusing on things.
Depression.
You were having inability to concentrate and focus on things. You can't be a high level performer with what you were suffering from. And it was just like releasing some knots in your back by freeing up some nerves in your neck and creating some stability. And all of a sudden you're just like,
I mean, this is like 4 or 5 years ago. I didn't even realize how much the C1, C2 instability was contributing to the TMJ, but also contributing to my POTS-like symptoms that I had for years. On that very first visit, I had tears in my eyes when you said you could fix it. And then I came to clinic, and you were able to, with exam, already tell me what was wrong. When he does an injection, it's really important to be ultrasound guided and have someone who's an expert on the ultrasound. Because my lordy, what did you show on you showed me on the ultrasound what you saw?
Well, I found her occipital nerves to be inflamed and thickened.
He could see the nerve being thickened, inflamed, and trapped.
So we found them, and then we looked at some of the instability in the way that the bones moved in her upper neck, and you could watch the movement of bones. You could see where the damage to the ligaments and whatnot was on the imaging. So I could tell where her ligaments were problematic. I could see where her muscles were overcompensating. I could see how they were compressing the
and he showed me.
upper neck.
He's like, do you see that nerve stuck right there?
Yeah, and that was great. And then once we were able to find that, and then, you know, with the physical exam, using my hands to touch her, we could essentially, there's the hot poker spot. You know, I push on it and she'd light her up. And
I gave you a finger, Maggie.
Yeah,
I might have given you a
swore
finger.
at me a few times.
Yeah, I'm okay.
And then I threw the ultrasound on there, and then we said, look, there's the problem. And then I was just trying to find a solution to fix it, which was just an elegant way of taking a small needle and some fluid and liberating the nerve from its entrapment in the fascia.
His favorite word on that one is hydrodissect. But what the layman's term is, he used the ultrasound to see exactly where a needle was going right next to the nerve, injected a saline water solution,
sugar
water solution.
Dextrose.
Yeah, very specific what he does with it. And he actually showed in the ultrasound the nerve stuck, and then he's pushing the water, and then you see the nerve suddenly go poof and start floating.
Yeah, it was really, it's just so satisfying to do.
I think I might have it on video.
It's like ASMR. I do have it on video.
You do?
I do.
Wow.
Yeah, and so we hydrodissect the nerve out, and it frees the nerve from being entrapped. And you have to understand that nerves can get entrapped anywhere in the human body.
Yeah.
It's not just, I mean, for her it was in her neck, but we see a lot in runners at like the knee. We see entrapment at the low back, which just a lot of nerve entrapments in the shoulder, other places. So we hydrodissect these nerves, carpal tunnel syndrome, cubital tunnel syndrome, so ulnar issues, wrist and palmar issues when typers.
That immediately solved 80% of my pain that I had had for 6 years.
And then the rest of it was stabilizing your cervical spine.
To figure out the root cause that's underlying your chronic disease or symptom, click the link above or below this video and register for the training. We'll see you there.